Hi and welcome back. In today's video, we're going to be covering different options for how to pay for your healthcare when you are uninsured. Because let's face it, healthcare is expensive and paying for health insurance premiums can be expensive as well. So, what do you do if you are uninsured? Well, this video should talk about it. So, let's get started. The reason why I want to make this video is because it is the truth. There are people out there who are uninsured because they cannot afford the insurance premiums for coverage. And that is something that sucks. And when you are sick, you should be entitled to get health care. So here are some options for people to lower their healthcare costs when they are uninsured, because it is not always necessary to immediately jump into going to the ER when you need services, as there are other options out there that can be helpful and affordable. So one option is called community care clinics. Those are the clinics that have often sliding scales, and they can be found in a lot of communities. Obviously, the bigger the community, as in the more people, the more likely that you will have a clinic, but there are options where you can look and receive health services from nearby adjacent counties or clinics if it is not available to you locally. So these community care clinics usually offer like the basics. So we're talking about wellness checks, the annuals, basic vaccine, checkups, basic labs, things that are not super complicated in the sense of things that you would need to go to an ER or get like additional authorizations if you had health insurance to get those services and testings done. We're talking like a blood draw, we're talking like a urine analysis for UTI, things that aren't so complicated. So one way to find them is using Google and searching for a community health center near you. And then it generally will give you a list and some ideas. If you don't have access to the internet, then I would recommend that you try checking your public library, because they very often have Wi-Fi for or computers in which you can access the internet for patrons, and therefore will be able to get services that you need for the search. State and county health departments. So state and like local healthcare centers aren't just about communicating outbreaks or just there when there is an outbreak. I'm thinking like COVID, because that's the biggest time I think I've ever in my life experienced like a lot of people then all of a sudden knowing where their local health department was. But it is an option. It is there. Our government does pay for it, so that way our American citizens have access to affordable healthcare. And so that is something that is government funded that you can potentially qualify for, and they do a lot of similar services that you may potentially need. So some of the services, again, not every state or every county health department has all the services. Again, it depends. They may have different buildings. They may have like a bigger like branch that handles things, and then like these smaller pop-up satellite ones, or connections where they'll refer you out, or you'll get like a voucher. There's lots of different ways that different states do it. But in general, immunizations, vaccines, STI testing, you got like TB testing. Sometimes they do prescriptions, health screenings, and the biggest one generally is prenatal support. So if you are pregnant, there is usually like more support for pregnant women that a state health center would have. Now, if that clinic in particular doesn't have that service, you can ask them, and they should be able to direct you to other places that have the services that you need, or they may be able to outsource it and give you, like I said, in some states, they'll give you a voucher that you could then take to a different medical provider to get whatever you need done. Another place that you can potentially find that not a lot of people know to search for are called federally qualified healthcare centers. So FQHCs. That's a term that you could look up in when you're on Google. But these are centers that are designated to handle like more complex cases. So we're talking like diabetes care, chronic health care, high blood pressure. They may be able to help more with like broken bones, and they maybe offer like physical therapy and like more specialized therapies within this building. Sometimes they'll have behavioral health, so like mental health services in this building. Occasionally, they'll even have dental care, But again, those are services that you can ask, call in advance, or, write, email, reach out, and they can direct you where you need to go. They will refer you out to specialists, but this is yet another type of facility that you can search for in order to be able to get services when you need them. Other affordable care options, I would say, is urgent cares that are affiliated with hospitals or affiliated with religious institutions. Those two will generally also have charity care or financial assistance programs, which if you watch the previous videos, you'll get more info on that. But there are certain urgent cares that are tied to the systems and therefore would be eligible for those type of discounts. Telehealth low-cost options. So now in the age of the internet, there are medical providers and websites that you can obtain prescriptions and have telehealth virtual conferences with a medical provider in order to get things addressed. This is not an option for all medical, needs, but it can address quite a bit. And so that is something that you can Google and find out. Or they will tell you how much a virtual visit is, and then they can work with you on whether or not you need referrals, whether or not what prescription discount options there are. Basically, there is this new option where you can get your medical health care online instead of having to step into or travel to an office. Urgent care versus an ER. If you are not needing urgent critical care right then at that moment, you could go to an urgent care. In most scenarios, in most medical billing cases, the billing done at an urgent center would be cheaper than those same codes being billed at an emergency room. So that's just another thing to consider. And you can, mention that you don't have insurance, and sometimes they will have uninsured discounts, and they will have other payment plans that an emergency room wouldn't generally have from the get-go. Well, what about prescriptions? So this is another thing that I think is not really talked about in the medical community. A lot of people just rely on their medical insurance to cover their prescriptions, but there are in fact other things out there now to get lower prescription costs. When you use these other programs though, generally then you can't also use insurance. So it's one or the other. A lot of people will do a price comparison between using insurance or these other options in order to see what is cheaper on their wallet, and then that's how they will process that particular prescription. So some options are pharmacy discount programs. So in some chain pharmacies, they actually will give you these little discount cards where they can type in a number in their back end system and get you a negotiated bulk pricing kind of deal. Amazon now also has a couple of prescriptions that you can do that will be discounted, and it's a membership kind of program. There's GoodRx, which is an app that you can use. They have a free version, which gives you a coupon, and then you have that code, and it tells you the pricing of your medication and the dosage that you have. And then it'll tell you all these different pharmacies that you can go to and their prices. So you can then find the pharmacy that's cheapest for you with a coupon and go there. GoodRx also has GoodRx Plus or Gold. It's where you pay and then they have an even better discount. Again, that's all negotiated bulk deal pricing. So that's kind of how they get it. You can also call the manufacturer and qualify for a discount. So in my particular case, when I had my son, or just before I had my son, I had gestational diabetes. And so I called the manufacturer of the Libre for the continuous glucose monitor and got a manufacturer's discount where I paid a set price per 3-pack of sensors instead of going through insurance or paying out of pocket for it. And it was a much better deal than if I even went through my insurance. So that was easy. Low cost generic options. So some people don't realize that you can get generics for a lot of medication now. So you can ask if there is a generic option, and that would be less than the name brand version. There are community clinic prescriptions and pharmacies that you can go to, in which case they may have a discounted price that they can offer then to their patients. In some communities, you would have to be prescribed by the community doctor, that community clinic's doctor, in order to use their pharmacies. And in some cases, that's not the case, and you can actually just use it as a pharmacy. So that's dependent, state dependent, county dependent. Just check that out in your area. So how can you locate these services? Well, you can Google. That's the best tip I can give you. And some of the search terms is community health center. You can do sliding scale. You can do uninsured pricing plans. You can search your state health department. You can call up your state health department in order to get information. When it comes to like a specific procedure, there are websites now that allow you to price compare a particular procedure, like the doctors and like the rough scale. So you could see that and also get that going. You can also call and check out the hospitals for a good faith estimate, which allows you to get the pricing on these different things that you might need. But you do generally, for that to happen, need to know the CPT codes. So that's just a little bit more complicated, but for those of you who are savvy enough to know or ask your doctor about what CPT code, then you might be able to get more information, and then you can kind of like price compare, because it does differ whether you get a service done in a hospital, in an outpatient center, in an inpatient center, whether or not, you have additional time, not. So there are a lot of nuance into like how these codes apply, but you can sometimes, ask for a cash price discount too. There's ways to manage the cost of certain things. You can also ask for a sliding scale. Even in a private clinic, a lot of places will have sliding scales, so that is something that you can ask for or search for. Now, when it comes to an emergency situation, please go to the emergency room. It's really hard for me to be here on the other side of the screen, knowing that there might be someone potentially in pain watching this video right now. Please, if you are in pain, if you feel like you're dying, go to the emergency room, deal with the stress of it later. Again, watch my other videos about like financial assistance programs and stuff, but please do not put your health in a decline by avoiding the doctors because you're afraid of the bill. By law, the emergency room has to treat you regardless if you can pay or not. There are so many different programs out there in a lot of hospitals that specifically deal and address with those who are uninsured, those who have, a catastrophic event in which, medically it was complicated and really expensive. They do have ways of lowering it, having plans, finding grants, dependent on the health crisis. Sometimes there are like grants within like different programs that get applied to a very specific subset of medical crises. So there are options. If you are hurting, if you are sick, please don't delay and put your health in a further risk. The longer you're in pain, the worse it could potentially get, or more life-threatening, and just it's not worth it. Your life is worth more than the bill on the other side. Okay? So yeah, sorry. I know usually at the end I'm really upbeat and like excited and like, I'll see you in the next video. But I know so many people who have avoided doing things medically because they were afraid of the cost, and then it ended up costing them even more because what was going to be simple became much more complicated due to like raging infection and complications. And just pretty please, if you're not feeling good, go get yourself checked out. There's various ways of doing it. You can Google all those, things, try to find those charity clinics, try to find the community clinics, try to find the charity care. Like, please, please, please take care of yourself if you're watching this. If this video was helpful, give it a like, comment. If you have any questions, let me know. If you have an idea for another video, let me know. More than happy to talk about it, and more than happy to talk about experiences related to it. Just again, please take care of yourself. And, I'm around if you want to, chat and, you need help searching for something, or like you don't know how to do it. Let me know. And you can find me here in this YouTube. I am the only person on this channel, so I will respond. If you see that little picture of me, it's me. But if you want to have a quicker way of reaching me, then join the school community. School's free. My community has a free, tier to it. So you can just join that. It's unmuted money. And there you can reach me via DM, and then we can, have a conversation back to forth. That's fine. Just again, pretty please take care of yourself. And I hope to see you in my next video. So yeah, until the next one, bye.